Have you ever wondered why many doctors spend years studying diseases and medications, but often receive very little training about the food we eat every day? Think about it. Diet plays a huge role in conditions like heart disease, diabetes, obesity, and even some cancers. Yet, for decades, nutrition education in medical schools has been surprisingly limited. But now, something important is changing in the United States. Medical schools are beginning to expand nutrition education for future doctors. And this shift could transform the way healthcare works, moving from simply treating illness to actually preventing it. In today's video, we're going to explore why nutrition has been overlooked in medical education, what changes are happening right now, and how this new focus could impact doctors, patients, and the entire healthcare system. By the end of this video, you'll understand why teaching doctors about food might be one of the most powerful ways to improve public health. Let's dive in. For many years, medical training in the United States has focused heavily on diagnosing diseases and prescribing treatments. Medical students spend countless hours studying anatomy, pharmacology, surgery, and pathology. These subjects are incredibly important, but when it comes to nutrition, the story has been very different. In fact, several studies have shown that many medical students receive less than 20 hours of nutrition education during their entire training. That's surprisingly small when you consider that diet is directly connected to some of the biggest health problems in the country. Heart disease remains the leading cause of death in the United States. Type 2 diabetes affects millions of people. Obesity rates have climbed steadily over the past few decades, and all of these conditions are strongly linked to lifestyle and diet. So why hasn't nutrition been a bigger part of medical education? One reason is that traditional medicine has focused more on treating problems after they appear. When someone develops high blood pressure, doctors prescribe medication. When cholesterol rises, they recommend drugs to lower it. These treatments can be life-saving, but they often address the symptoms rather than the root causes. Another reason is time. Medical school curriculums are already packed with information. Educators have to decide what subjects deserve the most attention, and historically, nutrition hasn't been prioritized the way other topics have. But today, many experts believe that approach needs to change. Health professionals, researchers, and policymakers are now recognizing that prevention is just as important as treatment, and nutrition is one of the most powerful tools for preventing disease in the first place. That's why a growing movement is calling for more nutrition education in medical schools across the country. The idea is simple. If doctors understand nutrition better, they can help patients make healthier choices before serious health problems develop. Recent initiatives are pushing for medical students to receive significantly more training in this area. Some proposals suggest at least 40 hours of nutrition education during medical school. That may not sound like a lot, but compared to the limited training many students currently receive, it's a major improvement. These programs aim to teach future doctors practical knowledge about food and health. Instead of just memorizing biochemical pathways, students learn how everyday eating habits affect real patients. For example, they may study how different diets influence blood sugar levels, how processed foods contribute to inflammation, or how balanced meals support heart health. They also learn how to talk with patients about food in a supportive and realistic way. This is important because nutrition advice isn't always simple. People come from different cultures, have different budgets, and face different challenges in their daily lives. A doctor needs to understand these factors to give advice that actually works. One major goal of expanding nutrition education is to shift healthcare toward prevention. Right now, many patients visit the doctor only after they develop serious health issues. But imagine a healthcare system where doctors actively help people stay healthy in the first place. If a patient shows early signs of prediabetes, a doctor trained in nutrition could guide them toward dietary changes that stabilize blood sugar. If someone struggles with high cholesterol, the doctor could recommend specific foods and habits that naturally support heart health. In some cases, lifestyle changes can reduce the need for medication or delay disease progression. This doesn't mean medications will disappear. Drugs and medical treatments will always play an important role, but adding strong nutrition knowledge gives doctors another powerful tool to help their patients. Another important benefit of nutrition education is improved communication between doctors and patients. Many people already know that healthy eating matters, but they often feel confused about what that actually means. One week, a new diet trend appears online. The next week, another study seems to contradict it. Low carb, low fat, keto, plant-based. There's an overwhelming amount of information out there. Doctors who understand nutrition can help cut through the confusion. Instead of giving vague advice like eat healthier, they can explain simple, practical steps that patients can follow. They might encourage more whole foods, fruits, vegetables, lean proteins, and balanced meals. They can also help patients understand portion sizes, hidden sugars, and how processed foods affect the body. When patients receive clear guidance from trusted medical professionals, they're more likely to make lasting changes. Medical schools are also starting to incorporate hands-on nutrition training. In some programs, students participate in cooking classes designed specifically for healthcare professionals. These classes teach future doctors how to prepare simple, healthy meals and understand real-world food choices. Other programs include visits to community markets, grocery store tours, and workshops on reading nutrition labels. These experiences help medical students see nutrition not just as science but as a practical part of everyday life. And that's crucial, because patients don't live in textbooks. They live in kitchens, grocery stores, workplaces, and busy households. Doctors who understand those realities can give advice that feels achievable instead of overwhelming. Another area where nutrition education can make a big difference is chronic disease management. Many chronic conditions are influenced by diet over long periods of time. For example, diets high in refined sugars and processed foods can increase the risk of metabolic diseases. Diets rich in vegetables, fiber, and healthy fats are associated with better heart health. Doctors who understand these connections can personalize recommendations based on each patient's needs. Someone with high blood pressure may benefit from reducing sodium and increasing potassium-rich foods like fruits and vegetables. A patient struggling with weight management might learn strategies for balanced meals and mindful eating. Even small adjustments can lead to meaningful improvements over time. And when patients begin to feel better, more energy, improved blood sugar levels, lower cholesterol, reinforces the power of healthy habits. Another reason this shift matters is the growing healthcare costs in the United States. Treating chronic diseases requires enormous resources. Hospital care, medications, surgeries, and long-term treatments all contribute to rising medical expenses. Prevention through nutrition could help reduce some of these costs. If more people adopt healthier diets early in life, fewer may develop severe health conditions later. That means fewer hospital visits, fewer complications, and potentially lower healthcare spending overall. Of course, improving public health isn't just about individual choices. Access to healthy food, education, and community support also play major roles. But doctors can be powerful voices in encouraging healthier lifestyles. There's also another interesting aspect of this movement: collaboration. Modern healthcare increasingly recognizes that no single professional has all the answers. Nutritionists, dietitians, physicians, nurses, and public health experts often work together to support patients. By giving doctors stronger nutrition training, they can collaborate more effectively with dietitians and other specialists. For example, a doctor might identify a patient who needs detailed dietary guidance and refer them to a registered dietitian. Because the doctor understands nutrition basics, the referral becomes part of a coordinated care plan rather than an afterthought. This team-based approach helps patients receive more comprehensive support. Of course, expanding nutrition education also comes with challenges. Medical schools must find room in already busy curriculums. Faculty members need training and resources to teach nutrition effectively, and the information must stay updated as new research emerges. Nutrition science continues to evolve, and educators must ensure that students learn evidence-based guidance rather than popular trends. Despite these challenges, momentum for change is growing. More universities are developing nutrition-focused programs. Healthcare organizations are encouraging lifestyle medicine training, and many students themselves are asking for stronger education in this area. Future doctors increasingly recognize that food plays a powerful role in health, and patients are paying attention too. People today are more interested than ever in understanding how diet affects their bodies. From gut health to inflammation to energy levels, nutrition has become a major topic in public conversations about wellness. When doctors are equipped with accurate knowledge, They can help guide these conversations in a responsible and helpful direction. So what might the future look like if nutrition education continues to expand? Imagine visiting your doctor and discussing not just symptoms, but daily habits that influence your health. Instead of a rushed appointment focused only on prescriptions, you might have conversations about balanced meals, stress management, physical activity, and sleep. Your doctor might ask questions about your typical breakfast, your grocery shopping habits, or the challenges you face when trying to eat healthier. Together, you could develop small, realistic steps that support long-term wellness. This kind of healthcare focuses on partnership rather than just treatment. And while nutrition education alone won't solve every health problem, it can play a powerful role in creating a healthier society. As more medical schools adopt these programs, future generations of doctors may approach healthcare with a broader perspective, one that recognizes food not just as fuel, but as a key factor in prevention, healing, and overall well-being. So to sum it all up, nutrition education is finally gaining the attention it deserves in U.S. medical schools. For years, many doctors received limited training in this essential topic. But new initiatives are working to change that by expanding nutrition education, teaching practical dietary guidance, and emphasizing disease prevention. The goal is simple but powerful. Give doctors the knowledge they need to help patients live healthier lives. If this movement continues to grow, it could transform the way healthcare works, shifting the focus from treating illness to preventing it in the first place. And that's a change that could benefit millions of people. If you found this video helpful or interesting, make sure to like the video and subscribe to the channel for more content about health, science, and wellness. And I'd love to hear from you in the comments. Do you think doctors should receive more nutrition training? Or have you ever received diet advice from a doctor that made a difference in your life? Thanks for watching, and I'll see you in the next video.